now?
Yes,
Fantastic. Is it coming through okay?
it's coming through okay. We can hear you loud and clear as well.
Fantastic. Marta, thank you very much, and welcome members. We too are a member. We've been a member of Hyperledger now for almost 4 years, and having been there since the very beginning, it's exciting to see the growth and the vibrancy. I was on Brian Behlendorf's Ask Me Anything earlier this week, and I was very excited to learn that they're now targeting Hyperledger Fabric 2.1 as a stable release. So that's shows that we're going to have the runway for the next couple of years. We too are a Hyperledger Fabric focused shop. And so what I'd like to talk about today was some of the work that we've done in the pharmaceutical supply chain, and talk about how we would be using blockchain for drug supply assurance and how COVID and coronavirus affect this kind of thinking in people's minds. So if we can go forward, as Marta said, feel free to ask questions in the Q&A box. And I've got Alex Colgan also from LedgerDomain here to help me answer these questions. So with no further ado, let's jump in and see if we can get through this. I'm going to move relatively quickly, but you can always come back and ask questions if I was less than clear. Thank you. Okay. So this is the LedgerDomain team. As we said, we're members of the Linux Foundation, the Hyperledger project, and in particular, we have a focus on regulated industries and healthcare. And GS1 is an important standard setting body in that area. The regulator for most of healthcare in the US is the FDA, and there's similar regulatory bodies all over the world that we have to adhere to. And I think one of the big things that we want to mention on the team side is that obviously it takes a complete group to build a really great Hyperledger application. It's not just a blockchain story. I think people will get really wrapped up in blockchain, I think, which is appropriate. It is great, but at the same time, you know, we're using many, many relational technologies, many other technologies to deliver the complete stack. And I think that you have to have a very deep and rich group in order to do that. On the pharmaceutical side, you can cut it up a couple of different ways. There's more traditional therapeutics that are like pills, and then there's devices, and that's a common break. And then separately, there's those that are being readied and tested for the market. Those would be what's called clinical studies or clinical supply. And then there's the commercialized products. And we work on all of the above. And so as an example, this is a project that we did with the Clinical Supply Blockchain Working Group. We worked with Pfizer, IQVIA, UPS, Merck, UCLA Health, GSK, Thermo Fisher, Biogen, and all of us together worked on the clinical supply chain. And the idea that they have here is that the number of studies has dramatically increased over the years. And one of the things to know about healthcare that makes it a little bit different from other businesses is it's highly fragmented. So even though Pfizer is one of the very biggest companies, they may only have 6% of the business globally. And even though Pfizer is a very important company, if you were at UCLA, you'd be doing 700 studies and maybe 30 of them would be Pfizer studies. And so the idea is that it's a very collaborative world, the healthcare world, even though it's competitive. And the idea is to try to deliver on a collaborative environment. And obviously blockchain with its privacy preserving elements is a great way to do that. And we engendered a lot of trust. I think there's some satisfaction for what these apps are doing, and there's some new needs, but oddly enough, the one area we've been very successful in is people's belief in the privacy and how they're getting the data and transactions that they need and sharing them as they want to. The focus today is on a more recent project called Bruin Chain. And Bruin Chain was a project that we did with UCLA and Biogen, where we did a pilot for the US government. The US FDA is trying to generate ideas for an interoperable system that will track all the drugs in the US within 3 years. This is an ongoing project. It's been going on for 7 years already, and it's been in the works since probably for 15 years. And so what we did was we offered up a blockchain-based product. There were 20 pilots altogether, and of the 20 pilots, probably 12 of them were blockchain orientated. Ours was one of the few that was actually tested live. But again, there was a lot of interest, and then we all showed our results to FDA, and they're going to be issuing a report on that to Congress in the US here, and they're going to be hosting a public meeting for everybody to see. So essentially, we're all in the mix here. We were not the only Hyperledger Fabric project. IBM, who you may know, was also on Hyperledger Fabric, and the partners included Walmart, which, as you know, is on the Hyperledger board, Merck, our Biogen, UCLA, who's also a Hyperledger member. So a really good representation, and I would say that it's a big win for the Hyperledger community, and we're really in the mix here. So what is the challenge that we're talking about? Today, there's no shared global database. And so you really don't know how many fakes there are out there. Everybody says the same thing, that when they study this, there's so many fakes in other countries. So European people will say there's so many fakes in Africa, and American people will say there's so many fakes in Europe. Everyone wants to believe their own supply chain is a little bit better, but we're all worried that in fact there are a lot of fake drugs. The drug we studied, Spinraza, is $100,000 a dose. The little tiny vial, $125,000. And to the untrained eye, it looks like water. And so how do you know that it's real? And so criminals are able to spoof, do man in the middle, and this patchwork of these different databases means nobody really knows for sure where their drug came from and where it went. And nobody knows how much inventory there is. And so, you know, we have drug shortages because everybody's hiding and hoarding their drugs. They're never quite sure what's going on. And you've been reading more and more about this in this COVID time. So this is the timing. So you can see that it's been a slow burn. Every year, another group has to be barcoded, another group has to prove out that they're following things. And we're all targeting this year end 2023 to have everything completely ready. At this point, everyone is supposed to be doing the right thing inside their four walls. I can tell you that they certainly wouldn't want to have a light shining on that right now today. So we focused on what we call the last mile. And if you think about it from a supply chain perspective, the last step in every supply chain is the one where there's the most error, the most entropy, the most confusion. We like to say that that's where the pieces of Humpty Dumpty we're trying to put back together. UCLA is an enormous, enormous pharmacy. It's the size of a large supermarket. And they have 300 pharmacists mixing and preparing and running things around. Many of these things are refrigerated or frozen. And of course, they're trying to make sure that everybody gets the right drug at the right time. And they're running through several $100 million worth of drugs every year, some of which cost as much as $4 million a dose. And so you drop one, you break it, you buy it. It's very, very tough. And so what we were trying to do was to help them perform these checks and verification. What do we mean by that? Verification is when you confirm that the drug is really a real drug, presumably with the manufacturer or somebody they've designated. The other checks would include, you know, is it expired? Is it a legitimate barcode? Is it match the drug that it looks like? All of those sorts of things are very important. The other thing is to flag any double counts. The double counts in our mind are specifically focused on counterfeits. The presumption is that a counterfeiter is going to just make a knockoff or a duplicate of an existing drug. But if you've already got it in the system, you've got to block the second one, or the third one, or the fifth one. The trick for us in Hyperledger land is the following. If you think about a Bitcoin model, Bitcoin is a fully digital system. It only has to agree with itself. And despite what people like to say about notarization or mining, of course, Bitcoin occasionally makes a mistake. But at the end of the day, Bitcoin itself is quote unquote always right. And so, whatever the miners decide is the tallest stack, it goes through. And maybe once in a while, one person gets harmed. But realistically, they all agree on a single version of the truth. And that's a terrific place to be. And many Hyperledger products would be the same way. If you're a fully digital system, all that matters is that Hyperledger Fabric or Sawtooth or whatever is doing what it's supposed to do. In the case of the supply chain, I want to be crystal clear on this point. The real world is always correct, and it always will be correct. The digital representation must be able to be adjusted so that it trues up. And so obviously you're going to have to think for a moment about how that's going to work. We've done this so that we can provide real-time inventory and quarantine at the refrigerator level at UCLA, but we could also help them address any challenges that they've got. Because of course, if there's a counterfeit product, digitally it wants to believe it's a real product. Or you've got to decide which is which and what you're going to do about it. We mentioned this escalation to 3911. If we believe something really bad has happened and it's just not a mistake, it's got to be reported to the FDA and the other stakeholders through this Form 3911. So let's talk a little bit first. Data science is always super important. Library science is always super important. Blockchain is a transaction system. Hyperledger Fabric is a transaction system. What are you transacting? And so in this case, for our pilot, we were transacting these barcodes on the side of the Spinraza. And you can see what we're doing here in this GIF. We're basically able, if we don't like what's going on, we send out a 3911 to somebody and say, listen, this looks sketchy. And it gets put into quarantine and it can't be administered until it's been resolved. So we're going to watch a short video. Alex, you're going to tell me, Marta, you're going to tell me if you can't hear it. It's just under 2 minutes, and this talks about all the great work that was done at UCLA.
Selected by the FDA for the DSCSA pilot project program, UCLA Health and LedgerDomain joined forces to create Bruin Chain, a blockchain-based solution designed to track and trace changes in drug custody, perform mandated DSCSA checks, and interoperate with trading partners. Bruin Chain was tested with real data in a real-world setting at one of the busiest hospitals in the United States. From the receiving bay to patient administration, caregivers scan the drug's unique 2D barcode using the Bruin Chain mobile app. This makes it possible to track the drug through the pharmacy at the stockroom level with every transaction logged on the blockchain. During its journey, the drug passes a series of checks until it's administered to the patient. Bruin Chain is also designed for exception handling. Under DSCSA and GS1 requirements, each barcode contains important information about the drug. When caregivers scan the barcode, this information is automatically extracted. New barcodes are routed to a trading partner for verification, and the drug is held back from being administered. At any time, the prescriber can view the progress of the drug through the pharmacy into the clinic. The trading partner can either verify the drug or indicate that there is a problem, such as a potential counterfeit. Trading partners can be provided with a real-time data stream on where their drug is and when that unit has been dispensed and even administered. If a drug is found to be suspect at any point, it is stickered and physically quarantined. If human review reveals a high risk of illegitimacy, Bruin Chain provides all the data needed to notify the FDA and trading partners. If the drug is verified as authentic, the prescriber gets a green light and can now administer with confidence. Beneath the surface, Bruin Chain passes messages and tracks changes in custody between 6 different roles. By combining blockchain with commercial off-the-shelf technology, Bruin Chain makes it possible to track and verify drugs in a busy hospital or neighborhood pharmacy. With Bruin Chain, doctors and pharmacists have a powerful new tool helping them in their mission to get the right drugs to the people who need them. Selected but
So before we go forward, I just wanted to recognize the UCLA team. They were really, really amazing. That was Dr. Perry Shea at the very end, using the iPhone that was connected to the Bruin Chain backend. That was Jess and Will, the head pharmacist and the head of procurement for the pharmacy on the front end. And really, you know, when you're mapping out these processes, you really, really need to have an expert who knows every angle, every corner case to help you through this stuff and figure out how you're going to model all of these things. And what are we modeling really? Let's talk about what we're doing here. You take the basic blockchain, you put the supply chain angle on it, and then you vascularize it with deep learning and notifications so that it can do the whole package. What does that include? In our case, all the inputs are coming through the barcodes. We've got to connect to legacy systems. In this case, it's the Biogen TraceLink system that keeps track of all the individual barcodes for verification on their end. All the data has to be countable, meaning we're going to show an inventory to UCLA, and so we have to be able to count up the barcodes. Just to be clear, you know, you'll get, some people get very excited about zero knowledge proofs or something else. You'll find that many blockchain formats are not amenable to counting. Hyperledger Fabric in its base form is. That's a differentiator for the positive. But if you use certain fancier techniques, you can end up washing that out. Again, the big thing is to block and remedy bad transactions and flag out-of-spec aggregates. What do we mean by that? Essentially, if you get a bunch of expired drugs, it tells you that you've got a freshness problem in your supply chain. You want to cluster those expired drugs. Of course, you're always going to get the occasional one that you need to block. Also, if you aggregate and you count all the drugs, you should be able to get a sense of whether there's a shortage or not. And then again, if you're clustering the kinds of problems that you have, you then outsource it to a risk management plane. Again, the first problem is not always the big problem, but the second one, it's sort of like a cockroach. If you've got one or two, you know you've probably got a lot. And so the idea is to raise these issues to the risk management plane and get a sense for what's going on. And we use machine learning robots to help us with that. And the biggest issue is what we call multifaceted client perspectives, and we'll talk about that a little bit more in a minute. Hyperledger Fabric started the show here. We're currently on 1.4, which is the stable release. Many of you probably have been practicing on 2.0. I think that's great. We're hearing great things. But in production, for us, we're sticking with 1.4. Everyone can vote here on what industry they're in, by the way. And so how do we use that? On the 1.4, everything in orange for us was standard Hyperledger Fabric out of the box, which means we're using, say, 14 out of 17 components. We were running on AWS, and in our white paper, you can find out a little bit more about everything else that we built in. So what is going on with Hyperledger? Obviously, we've got the flexible modular design. That's legit. It's not really that it's just modular, but you can actually use the components that you want. And because it's open source, you can tweak the ones that you need to tweak. It's got the backing of major industry players. Obviously, IBM has been huge in Hyperledger Fabric. Obviously, Intel's been a big Hyperledger supporter over time. Clearly, we've got a healthy developer community, always looking to get healthier, great documentation. And the problem, however, is, as I said at the beginning, to develop an end-to-end understanding, you need a couple guys who are really all over Hyperledger Fabric. You need people who can help you put all of the other outboard apps on there. The smart contracts are a matter of a lot of interest. I don't know that that's the hardest part by any stretch, but you've got to make sure the data science matches up. For Hyperledger in general, and for the blockchain community even more in general, obviously there's still a lot of issues around governance and orchestration. Who gets to update a smart contract? Who gets to add a member? These things are all arranged pretty well within Hyperledger. We've added some other features ourselves, but it's also getting all the people to agree. So what are we doing here? As we said, Hyperledger is an outstanding starting point for enterprise communities. We add 4 additional components that we've built: the Fabric DevOps toolkit to sort of spin it up, the SDK, so we have an intermediate client that's talking to the ultimate client. The DocuSeal is the actual client framework that we use. And that's also who's talking to the Hyperledger private collections. And then we use Oraculous for interoperating between the blockchain and the outside world. That's our machine-to-machine connection. And so what we've done in addition, everybody's got their own choices. So what we did was we strictly write the server side 100% in Golang, and we'll use that SDK to be able to deliver a multi-threaded experience. And again, we're not a heavy channels user, we're a heavy private collections user. So that's what it looks like. Again, the orange is the standard out of the box Hyperledger. The blue are the additional things that we've added to make it work a little bit better for us and to meet our goals. Obviously, we target highly regulated industries where the privacy preserving elements are critical, not just at the member level, but at the transaction level. And then we have our application specific architecture that sits on top of that. We are very iPhone oriented, certainly in our initial steps and in our pilots. We try to push the iPhone. There's nothing special with respect to the iPhone in terms of Hyperledger. And I don't believe that Apple has a particular role to play today in Hyperledger. I'm sure we'd love to get them more involved. But for us, it provides a nice end-to-end security model that our customers can more easily work with. Obviously, your blockchain fans are going to be excited to see something that looks like a blockchain. Most of our users are looking for a consumery type app that they feel comfortable with out of the box. So what were our learnings and outcomes? The barcode scanning on the iPhone was 100% effective. The refrigerator level inventory was available for every drug. So you knew exactly which refrigerator in this huge pharmacy that everything was in. We were able to track expiration dates, verify the barcodes, and inspect for physical problems. And we then verified with the manufacturer, Biogen, and we automatically flagged double counts and suspect transactions. And then the big thing is we notified the colleagues about all of this going on. And you can look this up in Blockchain in Healthcare Today. I'll give them a little plug here. They are an outstanding journal. It's peer reviewed. They gave us a bit of a hard time on every point, but you know that what you're seeing there has been very carefully vetted. That's one of the ways that I think you can demonstrate to your customers and prospects that you're really serious about delivering something of quality. On the right-hand side, we'll talk about another way that we did that, a live demo with, I think, close to 100 people in our industry. And we actually ran the system in real time with Splunk. Splunk's another Hyperledger community member that's a tremendous friend. And what Splunk enabled us to do in real time is to show how fast everything was running. So obviously for the drug industry in the US, we're talking about 5 billion transactions a year. And that's about 1.5 billion what we call saleable units. In America, this is not true in other countries as much. We still take big bottles at the pharmacy and break them down to little bottles. The big bottle has the barcode on it. And so you don't end up with quite as many transactions to count, about 1.5 billion. That's about 5 million a day, or 87 a second. But that's just at the retail level. Obviously, each drug goes through a couple of hops, starting with the manufacturer to the wholesaler. So what we were targeting was about 250 per second. Now you're gonna hear people say, again and again and again to you that blockchain is slow, Bitcoin is slow, Hyperledger can be slow. By going to multi-threaded, by making sure that we kept the extra stuff off the blockchain, we're hitting 340 transactions per second. Here we show it at 329. For us, we cut that in half because we actually have 2 blockchain transactions for every pharmacy transaction. And I want to be clear about that. As you add abstractions on the blockchain and you're writing back and forth again and again, you end up bogging yourself down. We actually have 12 different layers of abstraction in our application, but what we've done is to pull as many as we could off the blockchain. We really only need that one write to the blockchain in order to make it all work together. And so the idea then is we're down to 2 blockchain transactions for every pharmacy transaction. In other words, a pharmacist would see this as a completed transaction. We had to check the blockchain twice. On the left-hand side, what we've done in the meantime, if you remember the test was just Spinraza, it was just one drug. We've now expanded that to 100,000 different drugs, 200,000 different packages. You can see on the GIF there that we pull from the barcode all the information that you need plus the med guide. And in addition, we check a master database that we've built for expiration extensions. Some drugs during COVID will get an extra 6 months, and any recalls. And then an updated package insert. So if they've added something to the med guide, we get the new one overnight. So these are our building blocks content-wise that we need for flagging and for 3911. So what would this look like if you were to build it out? We did it at UCLA and Biogen. So that's, you could say, you know, one purple one and one dispenser. What would the entire network look like? This is what it would look like in our minds. Each of the big wholesalers would have their own org. The manufacturers would not have to be blockchain participants because we can just fish out each of their barcodes individually. Obviously, we need a master certificate authority and an orderer to make everything run. And then each org obviously has its own peers, its own private data, and its own CA for its members. Okay, so that's a fair amount of complexity. I see a question on the line. Will there be a demand for Hyperledger engineers to set up such blockchain networks over the next 10 years? I'm going to answer that one and say that way we do it, we have our chief software architect who thinks about these bigger picture issues and how they're going to work together. We have our key machine learning and DocuSeal frameworks lead who manages all of the thinking around there. And then we have a DevOps guy who actually keeps everything up and running in real time. And so, yes, it's an implementation detail to figure out how many orgs you need, how you set them up, how the memberships are done. Then there's a whole effort around making sure that each of the individual users types is supported. So in our case, you remember we had a doctor, we had a pharmacist, we had a technician. All of those people had their own role to play and they got different screens. And then we had a manager who had to resolve any problems. So yes, I think there's going to be a lot going on, and there's going to be at the community level and at the company level, which might run an org, you're going to need some talented people to help you out. All right, so let's talk about COVID for a minute. COVID is really laying bare how the supply chain is struggling. It's been struggling for years. It's been held together with tape and Post-it notes. And so this helps us focus on that. In addition, there's more and more drug that's going to have to go direct to patient in certain situations. And so I think it's going to be a really challenging environment. Obviously, blockchain providers are looking to fill the gap. And we're able to show a fast trace with our real-time focus and a secure tracking with the ability to cut out the man in the middle. And so, we see ourselves being an important participant in this overall scheme, but this was already planned in many countries already with the DSCSA law. And I think that COVID only makes it more apparent what's needed. There's a question on the line about the progress on adoption by pharma companies. So as we showed it, interestingly, I would say that it's more important that the wholesalers and the dispensers adopt our product. In a way, the pharma companies need to give us an open API, but we're very involved. I was already on a call this morning about identity. And so I would say that we're seeing a tremendous move in this direction. There's also some individual effort by individual pharma companies. I can't talk about all of these things. As I mentioned earlier, the FDA is quite serious about maintaining privacy and confidentiality of participation. There will be, however, I believe, a public meeting coming up, and you'll get to see everybody's opinions, which is always fun and exciting. But what we see at this point is a lot of support of blockchain by the FDA and a lot of interest. The FDA had their FDA modernization plan yesterday that they reviewed with the public. I was on that call, and they were quite open about their support, I thought. You can judge for yourself. And individual pharmas, I would say, are obviously looking to find ways to meet their regulatory burden. And we'll just have to see how it goes. But yes, we have a very active, ongoing dialogue. So ultimately, where are we taking all of this? Chain code portability, blockchain federation. People are looking to integrate the data and integrate various different blockchains. We're looking for more robust models and standards for organizations, more permissions, more roles. I think Hyperledger is one of our real advantages is we have very nice role-based access. I think that's terrific. It has served us very well, and I'd encourage you to take a look at it. And then, of course, more analytics on chain data. You saw us use Splunk. We think Splunk is terrific. You can see on the Splunk blog that we've got exactly how we used it. One of the things I would say is that we use Splunk as a full stack approach, meaning, it's not just transaction speed. We use it for debugging, that kind of thing. Obviously, we're going to keep upgrading to the next generation crypto models, and we need to do a better job of integrating with enterprise systems like ERP and MES. So notionally, the way to think about it is that blockchain, artificial intelligence, Internet of Things are going to combine to make everything instantaneous, confidential, and trackable. So another question on the line about how do we maintain the privacy? As I mentioned, we're heavy users of private collections so that each of the organizations that's transacting is keeping their transaction information in private storage, and we're only hashing to the blockchain. And then we also have the role-based access because there's a lot of privacy needs inside of organizations as well. We are not big users of channels. We think channels are great when you have participants that are doing unique things with one another, as opposed to unique transactions. So, essentially, if you think about something basic like payment terms, and you say you wanted to capture payment terms, presumably in the industry that's important. Everybody has payment terms. Channels are great when somebody has something that they track or something that they do that's completely separate that they just do with one other person. Question from Mr. Simpson on the line. do we believe that the end-to-end process for drug supply is similar to other industry supply chains like food supply, and are there lessons learned? Yes, there are. Our friends at IBM have a food supply chain. They tried to move the model to use the food supply chain, which they call food trust, over to the drug side. They've reported to us that it's not so easy. We've never tried that. We have built a lot of individual components that would be easy to repurpose. I think the biggest challenge is really the data model. And each industry has its own data model, its own practices. I think there's a lot to learn there. The biggest one being this idea that you really have to understand the difference between a data transaction and a real transaction. You have to handle it differently, and you have to have exception handling. That's really core. So in our case, for instance, if you think about a standard supply chain, if Alex is the morning warehouseman and I'm the afternoon warehouseman, if Alex takes in a new bottle of drugs and in the afternoon I release it to a pharmacist, we know that the warehouse was +1, it was -1, so there's no net change. In all blockchain systems out of the box, Alex's wallet is +1 and mine is -1. That doesn't make any sense in the supply chain world. There has to be an underlying inventory store that you're referencing, right? But if you make the inventory store the wallet, then you don't really have anybody signing it. You don't have the controls that you need. So you have to have multiple layers of controls to make a blockchain work. Millard has a great question, which is my favorite question of the day. Do we have plans to extend this to consumers? I want to be crystal clear on this point. We are a software vendor. Our job is to deliver products and services that our customers want. Personally, nothing would make me prouder than if we were able to extend the ability to check drugs all the way to the consumer. But the law, in this case, only requires that it goes to the pharmacist. And so we have shared with FDA, we've shared with our customers that they could offer this all the way down to their individual customers. It's something we would love to see. But again, the biggest thing for us is to deliver on what our customers need. That's hard enough already. But I do think over time that we'll see that kind of thing. Should we open it up to any other live questions apart from the chat, or how do we want to handle this, Alex and Marta?
Well, if you are done with your presentation, then of course we should leave it up to for answering the questions. However, if you'd like to finish your talk, then or have anything to add, rather, then go ahead and add.
No, that was it. So we're ready to take questions.
Great. So I believe that, oh, there is another question. Have you considered adding tokens as a way to encourage suppliers to compete to be more responsive?
So that's a great question. We have proposed, and it's a matter of public, so we're not breaking any, we have proposed that the FDA consider in our Bruin Chain model that there would be a normal dollar fee of maybe 10 cents to put an asset on the blockchain, and a countervailing 10-cent paid out for anybody to take assets off the blockchain. So in other words, if you retire an asset, you get some money, and if you put up an asset, you take some down. I don't know if I would call that a token, because I think we're just talking about regular US dollars, but we could always arrange it in a token style. You know, it could be implemented in a token style model with a fab token or something like that. But again, those are very much customer decisions. I see a question on the line. How could this be implemented in low and middle income countries where the supply chain is not really documented? This is really important. There's a perception that certain countries are so advanced and other countries are not. And I would tell you that I don't think that's true anymore. You know, essentially there's people with iPhones or Android phones, and there's billions of those people. And so if you looked at our system, you would see that we're running on AWS, which you can get almost anywhere. We can run all of this for the whole US on 3 or 4 servers. And then everyone else could be on a phone. And nowadays, I think of every country has phones, and that's our whole thing. So we really believe that this model and the Hyperledger model really democratize this. And in some respects, I would rather implement a product like this in a fast growing, exciting new country than to try to pave over all of the older legacy systems that we have in countries like the US. So I would take the position that, you know, these younger tiger countries are the perfect place for these kinds of things. So to your point on the frequent flyer model, yes, I would say that we are expecting that there's a couple of ideas that people will have. To be honest, many more of these traditional industries are worried about abuse. And so they actually want to identify people who are asking too many questions and aren't big customers. In real life, who would act as a controller of the network to allow members to participate? The way we're organized, and it's what I call the membership cascade, is common to Hyperledger. The orgs would definitely be a big administrative person at a big company. So Pfizer or McKesson or one of these guys would have an org. They would then decide about which of their employees would go on. So Pfizer has 130,000 employees. They've told us that they want 200 of those people on this system. That's up to them. And so in our case, there are somebody who has to manage membership of the smaller players. So every little pharmacy also has to be on board. And we're working on that now. How do we manage that participation? There are those who are fans of DIDs. You can look those up. There's a number of different ways to manage those identities, and we have our own thoughts, but that's exactly right. And I assume that's what Bisma is talking about on the identity certs, what I would call DIDs, distributed IDs. All of these things are part of the process. And then on the consumer side, they might be able to access blockchain data of certain data sets without identity at all. We could just let them query but not write. So over time, we see sort of 5 levels. One of the people at our firm might be the sys administrator, and they don't have access to any of the private transactions, but they provision the orgs and the new smart contracts. Then you have the org administrator who manages the role of that company, their peers, their members, and signs off on any changes to the community. Then you have the regular members that have their roles, and they would be provisioned by their org, and they would be able to do transactions. And then you might have some people that are just able to access data or provide what we call oraculous query answers without being full members. Does that make sense? Marta, how are we doing on time? How many more questions can we take?
We still have quite a bit of time, about 5 minutes.
Okay.
So go for it and answer the questions that you'd like to answer.
I'll answer any question.
Sure. So, well, we have the. Did you see the question from Pascal? What can manufacturers do internally to better prepare for and meet future requirements?
Oh, okay, I got to scroll up. I apologize.
No, this is in the chat. So what can manufacturers do internally to better prepare and meet future requirements that come from such ledger developments in the industry? And just a comment from Daniel, great point about the developing countries after needing less stripping away of the infrastructure, sometimes easier to start on a cleaner slate.
Yes, totally agree. So basically on the, Suresh is asking, do the companies see this as a benefit to them, I think. I think they do. Obviously, if you're Biogen and you're selling your Spinraza for $100,000 a dose, you want to make sure that it really is a real Spinraza out there and that there's no counterfeits. And if something got stolen and it popped up in the wrong country, they would like to know that. They would like to understand that they thought they were distributing it to Russia or India and now it's in the United States, and how did it get there? All those kinds of things are questions that they would very much like to know. And of course, most importantly for the manufacturers, over time, they believe that if this is configured appropriately, that they could also understand whether they have a shortage in the channel. And if there's a shortage of drug, they know to make and release new drug, and they know that they could get in trouble or just not make as much money by having a shortage. At the same time, if there's too much drug in the channel, then they know that they've made too much and they can sort of relax a little bit. Bisma's asking about identity again. Yes, we're big fans of looking at identity. This is a topic that I regard as really being the hot topic now of, is your identity embedded in your application, in your community, which is what we did here, or are you using what I would call a floating wallet or a DID as a route to sort of kick things off? Those are all important questions. I think you'll see that Hyperledger has a number of different projects going on. I'm sure Marta could fill you in more, but there's Indy and Besu and all these things. There's so many ways to do this stuff. It's actually quite complex. It's probably beyond the scope of today's talk, but I think that as you're educating yourself, it's certainly, you want to take a closer look at these different identity options. And how do we expand this beyond UCLA, and how does it compete with existing systems like TraceLink? So TraceLink and SAP in this case are the traditional vendors that the big drug companies use to keep track of the barcodes and the drugs that they've made. And TraceLink will sell services to people like UCLA to help them understand whether the lot that they're looking at is a good lot. TraceLink is just starting to get into serialization, and they did an FDA pilot and they have their own perspectives on where it's going. I think that all of us are looking to work together now to try to identify the roots of a new solution. I think it's true, although I'm not going to speak for TraceLink, I would tell you that it was publicly reported that TraceLink was also on Hyperledger Fabric. So you're thinking, we're on Hyperledger Fabric, IBM's on Hyperledger Fabric, TraceLink presumably is on Hyperledger Fabric. You know, I think that we're seeing it really bubble up as the system of choice. And of course, it would be very, not trivial, but it would be very doable for us and IBM and TraceLink to pass messages in Fabric. That was what it was designed to do. Do we have more questions on other channels? Marta, anything else?
Not that I see. I think you answered all the questions. Milind was asking in real life who would act as a controller. I think you answered this question.
Yeah, I would just be careful about that phrase. There's really nobody who controls the network. And so if Dr. Victor Dodds of LedgerDomain is quote unquote controlling the system administrator job, he can't see anyone's transactions. We call it a lights out model. All he can do is provision new orgs and to update the smart contracts, right? And so by himself, he really can't do much of anything. And that's how we like it. And so there's a perception that people have from the old days that the administrator can do anything and write over anything and change any data, and nobody's any the wiser. You know, Hyperledger has some great fail safes that keep us from doing that, and we've definitely sort of enforced that. Well, thanks very much. This was awesome. You know how to reach me, and Marta knows how to reach me, and you guys know how to reach Alex. And we're very, very pleased to take questions beyond outreach. And I hope I'll see all of you at the member meeting, which, Marta, is that September 10th and 11th?
9th and 10th. For those of you who are members, yes, we will have our member meeting virtual at the Mer Summit.
The member meeting is a great opportunity to meet other members. It's a great time to join ahead of the member meeting for those of you that are considering membership. And hopefully we'll see you all there. It'll be terrific. And I think we're celebrating a very great anniversary here at Hyperledger this year. And it's a great time to join. Thanks so much, Marta, for hosting. And I'm going to turn it back to you.
Thank you, Ben. This was brilliant. I heard you speaking before, but you are still one of the better presenters I know. Coming up, we have webinars every 2 weeks, well, every first and third Wednesday of the month. So Thursday, Wednesday of July, we will listen to DLT Labs talking about their use case with Walmart on improving margin visibility and transparency throughout the supply chain. And then at the beginning of August, we actually have a project webinar, first of them, of the project webinars that we'll be hosting. So for those of you who are a bit more techie, this will be a good update on BESU roadmap, what is coming up and what are the current solutions. If you're hungry for more content, we have all of the recordings of sessions that happened at Hyperledger Global Forum. So please go visit our YouTube channel to watch the videos or watch the recordings and download the presentations. And please do get involved. If you all have any questions, if you have any ideas, email us, go to the chat, go to the mailing list. We are a really friendly and open community, I promise you. And with that, thank you so much for joining us and have a great day.